First of all, I'm not surprised. We've known all along that the hospital is hemorrhaging.
Committee on Health Chair Senator Dennis Rodriguez Jr. is referring to the Office of Public Accountability's latest report on GMH's compensation controls, which revealed, quote, weak basic controls to ensure authorized and accurate compensation to personnel who were paid more than $100,000 annually, end quote.
And what we found there is that there's pretty much a lack of oversight, and where there was no policies established for thresholds, and even safe hour policies were violated, and also timekeeping controls weren't in place.
Audit Supervisor Llewellyn Terlahi says the OPA report shows this was particularly prevalent for physicians' compensation, where there was a general lack of review or reluctance to question the hours worked by doctors. Further, there is no system in place to correlate the hours compensated to physicians compared to billable hours charged to patients. These and other management oversight weaknesses contributed to employees receiving more than 25% over their base pay between fiscal years 2009 through 2011. Rodriguez says GMH management needs to crack down now more than ever.
They need to ensure that even physicians, doctors are held accountable. And the audit will show you now that I think physicians were able to do whatever they wanted to do without anyone looking over them, without the proper oversight.
Public Auditor Doris Flores Brooks says many of the findings were surprising, including how one full-time emergency physician was averaging some 50 hours per week and had a second full-time employment, yet not a single record on file was kept on the hours he was working. Meanwhile, in 2010, a radiologist received compensation of $765,000, or 219% over the base pay authorized for part-time radiologists.
Another physician has been working on average over 60 hours plus per week and did not take any leave in the 3 years, annual or sick leave, and yet was averaging over 60 plus hours per week for 3 years straight.
The OPA has since met with GMH officials where they did concur with the OPA's findings. More than a handful of recommendations were suggested to include enforcing GMH's policy for all employees to clock in electronically, establish built-in mechanism with a payroll system, implementing compensation threshold policies, and developing a tracking system to correlate physicians' hours worked and paid to billings by physicians.
What's next is, does GMH have the political will to implement these changes and these controls? That's really the next thing, because if costs don't change, then that's indicative that they have not really implemented the policy.
To read the full report, log on to GuamOPA.org. Reporting for Guam's News Network, I'm Ken Quintanilla.